All right, we're at the top of the hour. So, Toya, I'm going to hand the waiting room over to you and I'm going to go ahead and get us started because every minute in this event is going to be so valuable. I don't want to miss any of it. So, to everybody who has joined us today, welcome. I'm so glad you're here. And Toya and John, I'm really glad that you're joining us. So excited for this event. So I will start by giving just a brief overview of the event. And the first thing I want to let you know is the event is scheduled for 90 minutes. The first hour is designated for our time with John and Toya from NRC Health. The remaining 30 minutes is for speed networking. And you could stay just for the event, but I highly encourage, if your calendar permits, to stay for the networking. The after event surveys, we get almost 100% every single event saying that the networking was just amazing. So I hope you'll stay. It's a really good time to get to meet others. John and Toya are both staying with us as well. So you might have an opportunity to be in a breakout room with them. So let me start the intro for the event. NRC Health recognizes that patient experiences extend beyond clinical encounters, encompassing emotions, perceptions, and interactions that shape the entire healthcare journey. In this vendor spotlight, John and Toya are excited to discuss, and they identify two key things: how human understanding brings a positive impact to the overall healthcare experience, and the role of NRC Health's human understanding solutions in helping their clients enhance their existing patient experience fundamentals and elevate them with innovative practices. And so let me do a quick bio for Toya and then for John. Toya Gorley has more than 20 years of experience in the healthcare industry. Toya is responsible for working with NRC Health's premier partners to gain a greater understanding of pain points in real practice and to develop and deliver improvement resources that help organizations turn aspirations into actions on the front lines. And she was just telling me about 3 videos on leadership that she just created, and they sound fantastic. Toya has a successful track record of working with healthcare executives, physicians, and nursing staff to define and achieve specific business objectives. She also has a passion for improving the experience for patients, families, and healthcare employees. Toya's career in patient experience began at the Cleveland Clinic, where she served as a project manager in the Office of Patient Experience and was promoted to Director of Service Excellence. Toya helped to build a startup patient experience consulting practice that partners with health systems across the country to develop and implement patient experience strategies. So you can see just what a valuable person this is to this event today. I'm so excited. And John's bio is equally as impressive. As the program director for human understanding, John Tanner leads NRC Health's product innovation efforts. Over the past 13 years, he has partnered with organizations across the country to define, position, and launch solutions that help health systems better understand their patients' needs. His team's products have enabled more than 400 health systems to capture and act on feedback from over 25 million patients annually. Annually, that's a ton. John is passionate about personalized healthcare experiences and believes that traditional benchmarks and dashboards overlook the millions of unique stories that could build stronger relationships and more individualized journeys. He is dedicated to delivering tools that unlock this potential. Okay, so now you see why I'm so excited. It's not just that it's NRC Health that we're learning about, but we're learning from Toya and John. And with that, I'm going to hand it over to you two.
Well, thank you so much. I'm going to get my screen shared here. Maybe we can get a quick verbal confirmation once it looks like that's working.
I see it.
Terrific. I learned something. I anticipate I'll learn a lot of things from this group today, but I learned something during every one of these presentations. The first thing I've learned is in future sessions, we'll have my bio go before Toya's, because despite what Denise said, I think Toya's is quite a bit more impressive. And you'll see that through the presentation today as well. Thank you so much, everyone, for the time today. Thank you, Denise, for the opportunity. Toya and I are so excited on behalf of NRC Health to have this kind of platform to share NRC Health's vision of human understanding and our mission around that. We're also really excited because the community that you've built here, just looking at some of your values, NRC Health definitely shares. So, we too want to disrupt the perception of patient experience in healthcare. And we're really excited to share some of the ways we've helped our partners make a ruckus in this area. So thank you so much for the platform, the opportunity here.
You're welcome.
All right. So you just learned who Toya and I are, so we can skip that part. And what we wanted to start out with is just a little bit of level setting on why we think human understanding in healthcare is so important. And the first of those reasons is that the patient experience is so broad and complex. And you will find a dozen plus organizations that have their version of the journey slide. And for every single one of them, the thing they have in common is that none of them are really comprehensive of what a journey in healthcare looks like. This is the absolute kind of like best case scenario for patient journey. And as simple as it can possibly get, And even within that, there's all sorts of nuance and difficulties. 35% of patients have no preference for any healthcare brand. So even finding a brand to get started and where to look is something that's difficult. When you look at things like scheduling care online, one of the most depressing stats I've ever come across is that 61% of patients skipped getting care because online scheduling is too complicated. Within that same study, which came from Notable, by the way, 75% of patients actually ended up scheduling care, who did schedule care through a call center because they couldn't do it online anyway. And so, where the online is supposed to help divert from the call center and it's supposed to make it easier, we've done kind of the exact opposite. CAP scores, I know I've seen Denise post about this in particular as well. CAP scores haven't moved since 2016. So, whatever we're doing as an industry has not had, I think, the expected benefits that we've all hoped for. And so this is as simple as it gets, and even this is complicated and difficult. So in that environment, what our vision for human understanding is that the way you fix that and you personalize journeys that are either that simple or more likely far more complex than that is you have to holistically understand what matters to each person you serve. And when you do that, we see really kind of benefits on both sides of the equation. It makes it easier for the patient to seek care, which means that as the health system, you're requiring more patients. So if you take this patient who I've named Bill here, and you understand that to Bill, what matters to him is convenience and location, then you can use that information to help acquire more patients like Bill. And when Bill's receiving care, if you understand how his past experiences have gone, what some of his expectations for care are, what his preferences for care are, then you can deliver better experiences. If you know someone like Bill prefers natural treatments over medicinal treatments. And if you know that the last time Bill was here, we made some faulty assumptions about him having a wife when his partner is in fact not a wife, then we can deliver better experiences. We can have better outcomes if you understand some of the risks. So that if you know Bill is someone who's unlikely to fill his medications or who is going to struggle to follow up with a scheduled appointment, then you can deliver better outcomes and make sure Bill gets home safely. And then if you understand to Bill in the 99.8% of his life that he's not in any one care cycle or care event, some of these things that he's managing through self-guided care, like what his next health needs are going to be, if he's someone who's likely to benefit from concierge medicine or telehealth, then you can build relevant brands to Bill in that 99.8% of his life. So really high level, that's what our vision of human understanding is, that the patient journey is complex and wide. Patient experience has tended to focus only on those clinical care events. And that when we widen that and really understand holistically throughout the entire healthcare experience what matters to Bill, then Bill gets better care and our health partners deliver better outcomes.
Yeah, John. I was just going to say, I am celebrating that, John.
Great.
John, I will add that the healthcare journey is complex. I agree with you 100%. It's also emotional. And that is such an important thing to keep in mind as we think about delivering care with human understanding. Our patients come to us feeling a range of emotions, and their feedback often points to very specific ones. Some examples are listed here. They come to us feeling afraid and frustrated and confused, and sometimes we make them feel rushed, or they're worried, or they feel like they don't have enough time. And they also feel positive emotions too. They can be relieved, or they trust us and they have feelings of gratitude. But these negative emotions can be heightened because of the complexities that you just described.
So with that kind of context, we want to use this to frame our conversation for the rest of this time, and hopefully lots of questions and interaction through this as well. But from my perspective, when I think about all of your jobs, it looks like one of the hardest jobs in the world to me. You have to have kind of both halves of this equation in a highly complicated kind of bureaucratic red tape system. You have to have this like heart of empathy that is all about culture and behaviors and recognition in the front line. And you have to partner that with really high like tactics and strong execution in terms of how you're understanding patients, delivering those insights up and down throughout the organization, turning that feedback into action and designing all the improvement processes that you all work on. And it feels really complicated from my point of view. And that's why this human understanding program that we've built is really centered on serving both of those. And when you look at how we teed this up, the journey is complex and involves a lot of tactics, and the patient experience is highly emotional. And so our program's designed to kind of solve both of those parts. And Toya is going to start us off on a lot of the kind of heart and empathy part of it. And then I'll come back and talk about how our tools help you execute on that plan.
Yeah. And we like to start with empathy first because that's the work that I love. And as John said, I know that your jobs are difficult. I've sat in your seats before. And I also know that many of us do this work because of the empathy piece, because we want to make a difference in the lives of others. And that work can also be equally challenging. It is ongoing and iterative and requires a lot of attention and focus. And so today I'd like to share just 3 components of a patient experience program focused on empathy. So the first is strengthening culture. And we believe that strengthening culture begins with understanding what really matters most to patients. And as it relates to human understanding, patient expectations are clear and high. And a few of those expectations are listed here. And you'll notice that these aren't new things. I mean, these are things that we know and things that we talk about often. However, we believe that if you're truly going to elevate your patient experience program with human understanding, these expectations have to be your true north. And you have to have tools that enable you to meet and even exceed these expectations with every patient every time. So just allow me to add a little color to these bullets. The first is treat me as more than a number. We know that patients don't want a transactional experience. Instead, they want relationships. Recognize me through your words and your actions. So see me as a unique individual. And I will talk a little bit more about that in a bit. The next is see the big picture of my life. I always say that most people don't identify as a patient. They see themselves, for instance, as a mother, a daughter, a poet, a dancer. And so when we honor the entirety of their humanity, that is what human understanding is all about. And then lastly, we have to respect the entire healthcare journey. Healthcare begins before they come into your organization and often extends beyond that. And the payment part of the experience is a critical part of the patient's journey. And so we have to keep that in mind as well. So at NRC Health, we ask real life patients, what does human understanding look like in real life? And those patients responded with simple, reasonable, doable behaviors that fall neatly into 3 categories that you see listed here on this slide. The first is connect with me. So behaviors like use the name that I prefer or take an interest in my family. The next group of behaviors is around listening to me. So being fully present, making eye contact, don't interrupt, don't make me feel rushed, and don't listen just to be polite, but listen to act on what you hear. And then the last category of behaviors involves partnership. So partner with me, treat me as an equal, be patient with me, call me with results and explanations. So I want to spend a little bit more time talking about listening because we believe that you can't have human understanding without listening. So the next slide underscores the importance of listening.
Toya, can I interrupt for just a second?
Yes, please, Denise.
I was so that list partner with me. It's so much longer than the other 2.
Yes.
And as I read those statements, I felt like that's where we often aren't addressing.
I agree with you, Denise. There's so much opportunity there for sure. I would add, Denise, that I think that there is an opportunity in this listening bucket as well. Our research tells us that listening is so impactful for the patient experience. And again, I know that that is not new to the folks on this call, but the research just underscores how powerful listening is. So from our national database, we have found that patients are 53% more likely to rate their stay a 9 or 10 if they believe that the nurse listened carefully to them. Through our market insights studies, which is the largest syndicated study in the country, we learned that patients were 267% more likely to report that they trust their provider if they also reported that their provider listened to them. And then lastly, also through our market insights study, we learned that listening to me is the #1 criteria for selecting a doctor. So again, these are powerful stats and evidence for listening. And not only listening in interactions, which is absolutely essential, but we also have to listen across that patient's healthcare journey.
Hey, Toya, there's a really great comment from Bruce here. I don't know if you're easily able to pull that up, but it would be great to hear you comment on that as well.
Yeah, Bruce, recognize me as me through words and actions. Where do you see training to do this? It's not natural to them, nor is it emphasized in school. Just because we all communicate doesn't do we do it effectively. Yeah. So I absolutely agree with this, Bruce. I think that training is an important part of ensuring that these behaviors are instilled in your organization. I think even before that, that we have to establish the expectation that these are behaviors that are required of you. And then we train to make sure that you know how to do it. And then we have systems in place to hold ourselves accountable for it. And I'm going to talk a little bit about that in a bit. So service recovery is another essential behavior that we believe is essential to conveying human understanding. And we think of service recovery as making right what went wrong, because we know that despite our best efforts, patients have unmet expectations, or they may be disappointed with the care or service that they receive. We also know that often patients leave our organization and they still need help when they have questions. And as I mentioned, the healthcare experience is emotional. And so there may be instances where we have to nurture and attend to a patient's emotions. And I always think about service recovery in three ways. It is a philosophy, it is a skill set, and it is also a process. So the philosophy is that everyone in your organization is responsible for doing service recovery. So no matter what your job title or what your role is, if a patient presents a concern, an unmet expectation, a disappointment, or if they're highly emotional, it is up to us to do what we can to turn those situations around. It is a skill set. And so this is getting at your question, Bruce. We have to teach everyone the skills to listen and empathize and apologize and to take ownership to turn those situations around. And lastly, when patients leave our organization and they tell us that they had a bad experience, we have to make sure that we have workflows in place to reach out to those patients quickly and do what we can to regain their trust and earn their loyalty. And John's going to talk more about that in a bit. So here are some very interesting stats related to service recovery. 84% of patients expect that you will follow up with them if they leave negative feedback about the service and care that they received from your organization. 41% of patients expect that you will follow up less than 12 hours after receiving an alert that there has been a disappointment or an unmet expectation. 64% want you to follow up less than 4 hours if that alert involves a clinical concern. 47% want you to follow up between 12 and 48 hours after receiving that alert. And I always think about that 48-hour point as that's sort of the tipping point, because 50% of patients say that if it takes more than 2 days for you to follow up, if they've shared a concern with you, then you are at risk for losing that patient. They will go to your competitor or tarnish your brand on social media. And so we have about 48 hours to turn these situations around. And 54% of patients want you to contact them by phone. So as you're thinking about your service recovery efforts, these stats provide really good guardrails for how and when to follow up. So instilling behaviors is another component of patient experience programs that exemplify human understanding. And I always say that, implementing programs, doing training, that's the easy work. Sustaining the behaviors is where it gets really challenging. And so this slide lists 10 behaviors that we believe, 10 tactics that we believe are necessary to make any behavior or best practice stick. And you will see here that I have highlighted with stars 6 of those behaviors. Every month, NRC Health facilitates a webinar where we feature one of our partners who has successfully implemented a behavior or a practice. And every month, each of those partners have identified these 6 starred behaviors or tactics as the ones that are necessary to sustain the practice. And I'll just add a little color to each of these. The first is we have to have strong, committed, visible leadership. So leaders have to be clear in their expectations. They have to role model the behaviors that they expect of others. They have to celebrate when those behaviors happen. I often say you have to celebrate behaviors more than scores, and you have to have systems in place to hold teams accountable to those behaviors. The next is we have to invite employees to co-design that practice. I often say that those closest to the work have the best ideas. And when we pull employees in to co-design, we instill more ownership of the practice or the behavior, more accountability, and we allow them to make that behavior real for their care setting and for the patients that they serve. We also have to educate and train and provide opportunities to practice, because we can't assume that people know how to demonstrate the behaviors that we expect of them. And then we have to observe and coach in the moment. We have to remove barriers so that they are in the best position to deliver on those behaviors. And then lastly, we have to communicate often why the behavior is important, how impactful it is, connected to our mission and values, and also connected to personal and intrinsic reasons that we all do this work. All right, so on the next slide is the last component that I will talk about today, and that is focus on frontline. John, you mentioned this early on. Human understanding is important on both sides of the stethoscope. And we all know that if our employees don't feel heard and respected and cared about, then they are less likely to deliver on those expectations that our patients have been so clear about. And so I am encouraging all patient experience leaders to consider employee well-being as a part of their patient experience strategies. And on the next slide, you will see a framework for what a comprehensive strategy to address employee well-being looks like. And you will notice that this strategy is more than just having pizza parties. Now, having pizza parties is lovely. I love parties and I love pizza, but we cannot stop there. We have to have tactics that make employees feel cared about and cared for. So, for example, we have to celebrate and recognize and reward and praise them for all of the great work that is happening every day in your organization. And John will talk about how our tools enable our partners to do this in a meaningful and easy way. We also have to encourage a culture of vulnerability. And by this, I mean, we have to make it okay and safe for our care providers to admit when they are struggling. So I talked about healthcare as being emotional for our patients. It is emotional for our care providers too. And so again, we have to make it okay for people to ask for help. And we also have to have resources available to help them when they need it. Now, on the other side of this strategy, we have to think bigger and broader about how we make our employees feel informed and valued and able to do the meaningful work that they were called to do. And this involves having systems in place for two-way, transparent, 24/7 communication. And by two-way, I mean we have to have systems in place to push information and information about what our employees want to know about. And some of those things may be difficult to share. So things about staffing, or maybe about a merger or acquisition, changes in leadership. We have to communicate those things. And then we also have to have systems in place where employees can easily share it with us so that we can act on their concerns and their questions. And then that communication has to be 24/7, because we are a 24/7 operation. And I have observed that often our communication is directed to those employees who work in the mornings and who work in our flagship facilities, not the offsite facilities. So again, thinking more broadly about how and when we communicate. We also have to focus on what the scores, and by scores, I mean patient experience scores, what they are meant to represent, not just the numbers. The scores are meant to represent our commitment to safe, high quality, human-centered care. And too often we only focus on the numbers. So again, John will talk about how our tools enable this. And lastly, we have to think about, are we offering competitive, contemporary compensation packages? Do we have clear opportunities for advancement? And are we ensuring that our team members have safe and manageable workloads? So all of these are necessary to address employee well-being. And again, I challenge and encourage all of you to think about how your experience strategies include components that I have noted here. So I will pause and ask for any questions or comments before turning over to you, John.
Toya, one quick one. Those webinars you mentioned on the best practices, are those available to everyone or just NRC Health clients?
Those are just NRC Health clients. All right. Looks like there are no questions right now, so I'll turn it over to you, John.
Great. Well, thank you so much, Toya. As hopefully everyone kind of heard, and we get so little disagreement with our view and philosophy of human understanding, but as you hear it, it's highly empathetic. It's very focused on the front line. It's very focused on the behaviors. And we get so many head nods, and reading some of the comments here, it seems like many in this group would agree with that philosophy and vision as well. So then that puts pressures on our tools. Like, we have to have the tools to help you deliver that and fulfill what seems like an obvious, though not easy, philosophy of human understanding. So our core capabilities of the patient experience platform, and these again, you would not find to be particularly unique to NRC Health. I think any of our major competitors, you would see very similar capabilities. But I think how we do it is unique to us, is that we help you understand. So we need to listen to patients across the entirety of that healthcare journey, across the entirety of the healthcare experience, not just that most recent clinical encounter that CAPS has all trained us to focus on. We have to take all of that feedback and not just turn it into data, but turn it into insights. And those have to inform stakeholders from the senior leaders, and even more importantly, the front line, who are most able to impact that experience. It has to get into form of insights into their hands. You have to be able to act on it on an N=1 individual personalized level. Patients give you feedback expecting you to act on it. Toya shared that stat: 84% expect follow-up if they give you negative feedback or a service complaint. So you have to be able to act on it. And there's lots of different types of actions, not just service recovery, we can enable. And then you've got to use it to drive continuous improvement, skill building, coaching, playbooks. More and more, we're seeing our partners use our tools in really human-centered design ways, and adding to a lot of the traditional PDCA and kind of lean processes that we've forever seen. So with these core capabilities, what I want to take a minute to do is look at just what we would think of as the fundamental, like, core minimum things that any patient experience platform has to be able to do, and then talk about how we've worked with partners, and our partners have really pushed us to evolve those with human understanding into kind of a next generation philosophy. So in terms of understanding, core capabilities that we can, of course, accomplish is asking patients, how did we do after the most recent visit, with all of the digital means of connection, text message, IVR, emails, that you can listen to. The question sets typically are short and they're flexible, and they can be rotated in and out based off of what you're working on in any targeted area. It should be really focused on a lot of that open-ended feedback as well. And we actually can personalize the communication mode to what patients have told us is their preferred mode of outreach, which helps with response rates as well. So all of that is basic, and of course our platform does. What we're really excited about is our partners pushing us towards some of these things of looking at, how do questions focus on not just how did we do, but how are you doing? How can we help? Looking to continually meet patients where they are and getting feedback into their workflows so they don't have to respond through a separate text message, separate email. I'm going to talk a couple examples of that. And then this ability to listen throughout the entire journey as well. So a couple things I just wanted to highlight here, in terms of connecting throughout that entire journey, is listening not just after the most recent visit, but before. We found a lot of success as well. And when we say listen before, in our view, it doesn't make a ton of sense to ask measurable questions before the visit. It's not like I'm trying to gather a net promoter score before a visit, but if you can connect into an appointment reminder, into the registration process, into e-check-in, into the patient portal, and ask them some very targeted questions around what makes you happy. What are your pressures in day-to-day life? What would you like the care team to know about you? What are your expectations and preferences for the upcoming visit? Those are very different types of questions that are about the patient and are connected into that workflow of check-in that can really set for a very personalized experience. And along those lines, a lot of the questions we are starting to see our most innovative partners ask are really focused on the person instead of focused on them. So I cannot remember who I stole this from, and I feel bad because it's definitely not my original thought. But one of our partners I was talking to said, my team's called the consumer insights team, but it should be called the us insights team, because the only thing I ask my consumers is what they think of me. And when you look at traditional CAPS-like questions or traditional short-form patient feedback questions, it is like, how likely would you be ready to recommend us? Did our staff explain things in a way you can understand? How easy did we make it for you? It's like all very us and we focused statements. And what we've seen a lot of adoption towards are these person-centered questions of, how did we make you feel? Would you like a nurse to contact you regarding any questions? What's your biggest pressure or worry? Like, what are the main concerns you have that you want to discuss? Very you focused questions. One of the next things around this capability set, asking all those questions at the end of a patient experience survey doesn't always make sense. So some of those questions might come before the appointment. Some of them might also come in different places of the journey. So one of the capabilities we've introduced this year is leveraging inbound feedback to minimize survey fatigue. So a really good example of this is the payment experience. Toya talked about what an important behavior that is to the overall patient experience. And when we talk to our typical partners, the conversation typically goes something like this. Do you understand how much the payment experience or the financial experience impacts your overall experience? Our partners say, nope, I have no idea. The real-time survey or the patient experience survey hits several weeks to several months before the bill hits. And unless if I get a complaint or my CEO gets a complaint through our website, then I'm pretty blind to that. Then we say, okay, great. And they say, oh, and I'm not surveying my patients anymore. Like, they're surveyed out. There is complete fatigue in terms of the number of surveys we're sending out. I can't send another text message or email or outreach around that. And so what we've worked with our partners on is, how do you just integrate a quick pop-up or a quick set of questions that's really focused again on, do you need someone to help you, into that process of payment? So the easiest way to visualize this is if you're paying online. As you click the payment button, you get a quick message that says, did everything go well for you? If they click no, say, would you like someone for your team to contact you? And they give you some contact information so someone from the rev cycle team can be notified and follow up with them. And then you might take an opportunity to ask a customer effort score or net promoter score as a part of that as well. You could do that through a QR code on the bill. And we've started here in the kind of patient financial experience, but we have partners starting to do this with scheduling and search and some of those other consumer-oriented experiences as well, and just make it feel as naturally a part of that experience as you can, or as that existing workflow. Next thing I wanted to highlight really quickly is that once you have this different type of feedback, it opens up opportunities to use it in different ways. So again, traditionally, and just core capabilities that we do and everyone in the world is going to do as well, is you have to be able to benchmark against your peers. That's just like a core expectation of our industry, for better or for worse. You have to have these system dashboards and analytics that allow you to drill through and get a really quick view as a system leader, where are my strengths and weaknesses throughout the organization, who's overperforming, who's underperforming, where do I need to focus? And then there definitely needs to be just a core expectation of natural language processing and text analytics. Gone are the days that survey data is just quantitative. We have to be able to take all the qualitative information and use that in a meaningful way as well. So we do all those things with human understanding, where our partners have started to push us to, and we're really excited about, is a little bit more focus on benchmarks that focus on equity. So instead of just benchmarking your scores against other academic regional medical centers or trauma level 3 centers, looking at how do you perform against the nation for patients who don't speak English as their first language, or how do you perform with certain demographics, age, race, ethnicities, and looking at how do you compare against your peers in those very specific ways. Looking at more and more person level analytics, which I'm going to come back to in a bit, but summarizing things not just at a location level or a provider level, but as a person level. What's everything we know about John? And then looking at team and provider digest. So one of the biggest opportunities we always hear from our partners, and we've put a lot of time into our tooling around, is how do you get feedback to the front line? Because they don't have time to go into another system. They can't keep track of another password, and they have no ability, by ability, I mean time, to carve out the room to really digest and absorb a lot of patient experience reports and scores and go digging for what's relevant to them. So what we've really focused on are this digest approach to inform the front line. And for quite a while, we've had provider summaries that do this, because it's pretty easy to attribute a score to a provider and deliver to them in an email a quick summary of what this month's patients have said. This year, we introduced the ability to do this for other frontline teams as well. So if it's a nursing team, a food services team, an environmental services team, practice managers, that they can build a digest specific to them. They can pick the questions that are relevant to them. So it might only be 1 or 2 questions on there. You can set a key metric or you cannot. And then more focus on a lot of the behavioral things and the stories. So what are the compliments that have come in over the last week or month or quarter? What are the most positive comment categories coming in? What are some opportunity comments and the negative comments that have come in? Is your team someone who's responsible for performance? For alert performance? Are you closing alerts? If so, are you going within that 24, 48 hours that Toya highlighted as being really crucial? Or are we creeping into that 72-hour range? We partner all of these digests with a coach's corner, so it comes with a library of content. And we're going to keep building that out over time as well, but we've heard it's really crucial that we don't just give data without a way to improve in these digests. And then there's also the ability to create some focus activities through an improvement planner that just helps you track, here's the activities I've assigned to my team as a leader, and see how some of those key metrics are moving since we've assigned those activities and that they're having the impact that we've actually want. They're delivered through the body of an email. They require no sign-in. You don't even have to open up the attachment, mobile first design, and make it really easy to use. We've also had a lot of focus on our text analytics this year, so everyone can kind of trend and categorize and add sentiment and themes to those. We've updated our model so that our themes are now very focused on DE&I initiatives, and we've added sentiments and themes around race, language, ethnicity, age, gender, sexuality, religion, and ability in our model. We've also focused on how we make patient feel, and Toya talked a lot about the importance of emotion, so our model now identifies the emotion that comes through that. And then starting to work on reports that take advantage of these themes in a different way. So for those groups of patients that were promoters and are now detractors, what are they commenting about? Or keywords that maybe our model hasn't picked up yet, but you're really focused on discharge instructions. And so you type in the word discharge instruction, we can tell you 71% of the comments that come up in that are negative. That's trending down over time, and you only have an average likelihood to recommend when that phrase appears in your comments. And then, of course, correlating that to key metrics and looking at how that changes over time. So a lot of emphasis on text analytics as well. Okay, so in terms of actions, I want to leave room for questions for everyone here too. So I'm going to just crank through a couple more of these. In terms of actions, the core capabilities that everyone should be able to do is looking at service recovery, clinical recovery, and then publishing and requesting reviews at the end of those surveys. We've done that for quite a long time. I know a lot of our peer vendors have done that as well. A couple areas we've been really focused this year is around recognition and compliments and then person level summaries. So looking at compliments, our natural language processing, this is almost just the inverse of service recovery. So now instead of identifying complaints and concerns that need followed up on because they're negative, these are really positive things that take the form of a compliment that our natural language processing has identified and gives you as a leader a very quick way to send these out in templated cards, e-cards to your frontline. And so far, so we introduced this in April, and right now we're sending about 1,000 of these a week to frontline leaders, which is really exciting. I just love the idea that we maybe are putting the smile on 1,000 care team members' faces each week, kind of indirectly through this capability. And we have some partners doing really cool things with this in terms of adding like a link to a gift card, or if they have a kudos program with points to the bottom of the template as well, so that if it's a really outstanding compliment, they can add to it. And it's really, we've just watched this build kind of a culture of recognition first, and using the feedback, because 80% of the feedback that comes in is positive. The vast majority of it is positive, and using that to really make sure that the front line's aware of that as well. And I know, Toya, you've had a couple examples working with partners in terms of making kind of recognition like a really standard behavior as well.
Yeah, I have. I am working with several partners who are having so much fun with this. One that comes to mind is an organization partnered with Nothing Bunt Cakes, and they give their employees a bunt cake, and that cake has the patient's comment attached to it. And it's become such an important part of their culture that employees will say things like, I'm going to earn a bunt today, right? And so it's just a fantastic way to use those comments to inspire the type of behaviors that we expect of anyone anyway, and to give a sweet treat to celebrate.
Thank you. All right. The other action that we've been really focused on, we actually introduced this kind of quietly in 2021 and have started to make a little bit more noise around it in 2022 and 2023, is the ability to summarize what we know about a patient into the EMR and specifically into Epic and Cerner of who we've gotten this turned on with so far, but working with others as well. And the kind of basic idea here is through those more you-oriented questions of what are your pressures, what are your risks, what are your goals, we can really highlight a lot of that for the care team to take action on personalizing that next experience. So when you walk into the room, 15 seconds before you walk in the room, you pull up the patient's chart, you see what NRC Health knows about them through what we call My View there as well. And the trick to using this is really picking the right questions that are useful and appropriate for the care team to act on. So what we don't have people doing and would not recommend doing is adding like an overall rate score here or a communication score or looking at some of those things that might make the frontline feel like they were graded or scored by this patient in the past, but really looking at those things like if you have preferences for care or expectations for care, or you've highlighted risks of you don't understand your care plan, or you went home without scheduling your follow-up appointment in the past, or you had questions around medication, these are things you can address proactively from the care team's point of view. And so this looks a little bit different for each of the partners that have turned this on, which is candidly still relatively few. But looking at, what are, of all these things we know from before and after experiences, what's useful to my care team and how can we personalize those experiences and make it available in the EMR in the moments before care. So this is definitely our newest thing here and still working through with some of our early partners on what's the right subset of information, how does it work? But philosophically, a lot of alignment from our core base on we can do a better job if we know the right bits of information from these other kind of experiences and the contextual information that we're gathering as well. One last thing I just want to highlight really quickly that we have a couple really innovative partners doing is taking the feedback that we're gathering for them and putting it into their CRM. So we've got people who have put it into Dynamics 365 and Salesforce and Axiom are the three that we've worked with so far, but of course, happy to work with others and really using these to create more targeted messages and campaigns for their patients based off of the feedback that we learn. So my favorite example of this is the one on the far left, which is the foundation, because it's really simple. If you had a 9 or a 10 experience with us recently, within 2 weeks, they're enrolled into a campaign of, thank you so much for your feedback. We're glad you had a great experience with us. Would you be willing to help others in your community have the same great care or get access to the same great care? And if they're a 0 through 8 in the last 2 weeks, like now's not the time to ask for money. And so they're really able to target those campaigns around there and starting to see our partners drag this into different areas as well, whether that's supporting new service lines or new offers or new communications based off of things that they're learning from our feedback. And then the last I'll highlight really quickly is process improvement. Core capabilities around this is goal setting and annual incentives and using correlation metrics and priority matrices to drive these kind of Six Sigma and Lean and Kaizen PDCA processes. Where we're seeing a lot of our partners take it to with our tool sets is more kind of human-centered design focus. And again, these are all and statements. People are doing both of these. And using tools, we call them community insights, but using our community insights product to do things like customer journey maps and track customer emotion or consumer emotion and value stream maps and crowdsource a lot of this wisdom from a community. And so we've seen this take place by way of like diving into particular key patient demographics and looking to improve their experience or launching new service lines, looking at, like concierge medicine. What would people be willing to pay? Would people in your community be willing to use it? Before the pandemic, telemedicine was a really popular area for us to do studies. Now everyone's kind of got their strategy there largely figured out, but you can test ads, you can test new brands, you can build communities of your employees and make sure you're listening to their voice and that they're giving feedback on any of these new design sessions as well, but really just a way to get the patient into the center of that. So with that, I think we're going to wrap up here and would love to leave room for some questions as well.
And I know that there's so much more you could share too.
Yeah, and I think we have, sorry, I meant to tee up Toya, we have one more slide around just some questions for you all as well.
Yeah, thanks, John. No, these are just a few questions to get your wheels turning about what you've heard us share today. We'd love to hear from you as well, and then also any additional questions that you might have for us.
So, John, you had showed when you were talking about the digest, and you had said something, I think you said something about food, and it made me curious, the QR code. Could that be a real-time thing that the QR code was on the patient meal tray or something like that, where you could truly get real-time about food service?
Yeah, it certainly could be. We haven't had anyone use it in that way yet, but it's a fantastic application of it. There'd be no reason not to.
That would be great because that wouldn't interfere with CAPS. You could definitely be gathering that information real time.
Yep.
And then Toya, you had a slide that talked about both sides of the stethoscope, and the way you referred to it, I totally agreed with. And I think Bruce kind of talked a little bit about this in his comments, but there's been discussions as of late how when patients come in and they're not recognizing that who they're dealing with, yes, is physician, is nurse, is whatever title of care delivery, they're also human. And how do we have, when you talk about both sides of the stethoscope, how are we building those relationships so that patients are also coming with the relationship side of ownership for themselves?
Yeah, Denise, that is a fantastic point. I am actually meeting with one of our partners on Monday to talk about that, like how, when we think about having a human-centered culture, having everyone show up with an empathic mindset, a mindset of safety. And so how do we infuse that into the partnership that we have with patients? And so I am having some conversations with others about that as I am gathering more and, coming up with some additional ideas on that. I'd be happy to share with you. But it's absolutely necessary. I agree with you there.
Exceptional.
I was just going to follow up with that and say that, I think fundamentally in healthcare, we're kind of dealing with non-reciprocal relationships in the sense that the healthcare professional really owes the patient everything, and the patient, it doesn't work the other way around. But on the other hand, having said that, having trained healthcare professionals and having been a patient who is able to provide a healthcare professional with positive feedback when it's warranted, it just changes the dynamic tremendously.
Yeah.
And having said that, though, on the other side, we train healthcare professionals to look for what the patient isn't doing. Yeah. You got a patient who's taking, a medicine 4 out of 7 days a week, and we focus on the 3 days they're not taking it rather than trying to find out why are they taking it 4 days a week. That's their motivation. So what's causing that? And let's focus on understanding that. So it really needs to work both ways.
Yeah, I agree with you, Bruce. We have some research that talks about empathy being behavioral. And one of the behaviors to demonstrate empathy is to meet that person where they are and celebrate what they're capable of. And to your point, then also determine what's getting in the way and doing what we can to help remove those barriers.
And just to add one small piece, we've done some research that shows that if you have empathy, if you assign a score of 1 to empathy, mm-hmm. and a score of 1 to addressing the issue, whatever it is of the patient, yeah. When you combine empathy with addressing the issue, yep. You get 7.
That's exactly right.
There's incredible synergy that takes place.
So true. And I would say conversely, if you combine addressing the issue with judgment, labeling, stereotyping, yep. Then that score is negative, right?
It goes nowhere.
Yeah.
Mm-hmm. And Brandy, I wonder if I can ask you if you would be willing, you said you put a comment in there saying this is a new favorite report of mine. I wonder if you'd be willing to share about your experience with that report.
Yeah. So it was, introduced to me in one of my last calls with my NRC team. Mm-hmm. And after I saw it, I was very excited for it because I felt it was tangible and focused and actually helping them say, like, here's where you're doing well, here's where we could maybe improve, and here's some resources that, might be able to help. And I thought that was really exciting to me. So then I brought it to my, nursing leader. So I started with them and said, do you feel that this would be good information for you guys? Would you rather see this than just the department summary or just the expectation scores or whatever? Sorry, experience scores. And they were very excited about it. And so they just received their first one in the month of October for their September scores, and very good feedback from it of just, they liked the comments that were on there. I will be honest, I actually on this first one, I left out the opportunity areas, like the negative comments or the opportunities, because I wanted it to be received in a happy way and exciting, and here's all the positive stuff, and here's the trends or whatever. And I told them that I was leaving that out, and that once we use it for a couple months, we could see what it would look like to put the other comments on there. Not that they're not important, they are, but I think sometimes just starting with the excitement, and the positive things kind of gets your leaders a little better. So
Brandy, but I love that you did that. I was at the PX symposium in Boston, and Brian, I cannot think of his last name, with Mayo, was talking about the research he's done on well-being. And when the frontline see those positive comments, their well-being scores go up.
Yeah.
exceptional.
Brandy, I just have to say you've made my day as well. So this is a very new report to NRC Health. We introduced this just in September, and Brandy's one of the first like really great use cases we've heard of it. And this idea of having the configurable nature of it to leave off the opportunities at first and just work on that is exactly what we had imagined of. Not every metric's appropriate for every team all the time. And so let's build what you're comfortable sharing with, and getting people into the process of building that engagement, we think is more important than getting all of the information at first. And so the story that Brandy just talked about, and I swear I didn't pay her to say this, is exactly what we had in mind when we built it. So you've made me so happy. Thank you.
You know, I think the thing that I love most about NRC Health, and Toya and John, you've just reflected that in this time with us today, is the true focus on human experience. I know it's within your organization because I know people who work within your organization, and I hear it from those clients that you partner with. So I just think it's phenomenal. And so we are ending this time together. I'm sure that there are more questions, and I encourage you to stay for speed networking because you might get into a room with Toya or John and be able to ask them some questions directly.